Every day, thousands of people arrive at CMC, the Christian Medical College in Vellore. They have journeyed from all over India and beyond, drawn by the excellence of the hospital's medical services and the reputation for trust and compassion held by its staff. In just over a century, CMC has grown from the small single-bed clinic started by its founder, Dr. Ida Scudder, into a huge modern facility, providing the standard of care that ensures it continues to be one of the finest hospitals in India. Each person arriving here has needs and hopes and brings to CMC their own story. CMC welcomes each one and incorporates their stories into its own ongoing narrative. This is an account of just some of the people who ensure that CMC delivers on its commitment to serve the poor and needy through education, research, rehabilitation, and most of all, medical services. These are our stories, our CMC. India has its own unique challenges, especially looking after the health of 1.2 billion people. CMC's director, Dr. Sunil Chandy, is keenly aware of the needs and is guiding a strategic response.
I have been given a mandate to respond to the changes and challenges that we see in our country. India is in rapid transition. There's a lot more affordability that our patients have. There's been a social migration from below poverty line to low middle class. There's a changing expectation of people in terms of health infrastructure and the way hospitals should function.
CMC has a threefold response to the health needs of India. Firstly, a commitment to develop and equip compassionate and ethical healthcare professionals through excellence in education and training who can serve the needy anywhere in the spirit of Christ. Secondly, to relieve suffering and promote good health through medical services in the community as well as through hospitals and clinics. And finally, to seek appropriate solutions to health needs through research and innovation. While formal lectures have already started in the medical school, there is a rush at the Nurses' College as the first of the buses leaves for the daily clinics and home visits to villages and communities that surround Vellore. It is here that the student nurses get to experience the hands-on training that is such an important part of all medical education at CMC.
This is definitely a good way of learning. Here we come, we open our eyes and learn the lessons of humanity. We open our ears and hear every other suffering and tears that they're going through, and we get to know the real sufferings of the people in the remote area.
Education has been integral to CMC since its inception. The founder, Dr. Ida Scudder, knew that if she was really going to make a difference to the sick and needy, that the training of local nurses, doctors and allied health workers would be essential. Over 100 years later, CMC has an enviable reputation for the excellence of its graduates. With their ward rounds finished, final year med students Baker and Prithviraj have been posted to practice their skills in the main hospital's neonatology wards.
Yeah, it's always hands-on, right from our second year to be at the bedside, and it gives us a sense of purpose and responsibility to study harder. If you're not right here, then a lot of things that we read in our books won't make sense. We always like coming to the neonatal ward because the babies are so cute and the mothers are happy that they've got new babies.
At the other end of the ward, student nurses Clara and Shalini have arrived to do some hands-on revision with a tutor. CMC's unique approach to its medical mission is achieved by the nature of the way it educates those who answer the call. Service in the spirit of Christ, relieving suffering and promoting health.
It's one of the primary colleges that send out doctors to be missionaries in the medical field. And since that's primarily what I wanted to be, I thought this would be the best place to get that.
When Kumaresan shattered his spine in a fall 6 years ago, the future looked bleak for the young man and his family. But CMC's commitment to holistic healthcare encompasses a vision to restore the wounded to meaningful community membership. The participation of CMC's Rehabilitation Department in Kumaresan's physical, mental and social recovery has inspired him to aim for a golden future.
Before fall itself, I was very much interested in sports. After fall, I was depressed, and then I met one rehab volunteer. He encouraged me, so you can participate in sports events.
International level shot put gold.
I would like to get a gold medal in international matches, especially Paralympics, especially shot put. That is my event. Apart from that, I am interested in javelin and then basketball also. I would like to participate in international matches.
Whether Kumaresan achieves his Paralympic dreams will depend on maintaining his training schedule and finding sponsorship. But thanks to the team at Rehab, Kumaresan has the drive and likes nothing better than to lead them out for an early morning training session.
I will definitely get gold medal for India and then for myself.
The cost of healthcare has escalated much faster than inflation or personal earnings, but CMC is determined to pioneer low-cost, effective solutions and, wherever possible, partners with community volunteers and other organizations to help those at the bottom of the economic ladder. By her own admission, Dr. Anna Tarayan thought she knew everything there was to know about mental health in India. Then a local man invited her to join him on a drive around the streets of Vellore.
He made the first request to get us as doctors out into the community. He pointed out people with mental illness who were sitting on the roadside. To my amazement, we discovered that each one had people who were looking after them. We discovered there were people who were feeding the mentally ill who were sitting on the roadside. People were reaching out to other human beings. And that is really what has started off a slightly different model of providing clinical services in psychiatry than what I had been doing for 30 years.
Understanding how the community interacts with sufferers of mental illness has allowed CMC's department to provide clinical support where it is needed most. Nowhere is this better seen than at the home of Prema and Ramesh, who provide shelter and support for over 100 people, and who now have Anna and her team working in tandem by providing clinical and psychiatric services for these lost souls.
This effort brings to a person with mental illness the family that is not there to support them. So it is caring about the individual, giving him a place in society, and also treating the illness from which the person suffers from. So it's literally restoring the fabric of society, which the illness has destroyed.
Running a huge hospital is not just about finding solutions to medical problems. Dr. Anna Pulimud never imagined that she would help turn CMC green. But discovering that the 12 tons of waste that the hospital and college generated each day was dumped in landfill was the impetus for a project that is inspiring a sustainable future, while having a significant impact on the lives of all those involved.
The project has a lot of benefits. So we do recycle all our waste instead of dumping it. We get some income from the waste because we're separating it out and generating compost and selling the plastic and cardboard. And we also employ a lot of poor women who need the jobs.
Other initiatives of CMC's Green team include water recycling, the generation of electricity through rooftop solar panels, and the new space-age dish at the front of the hospital that heats water by harnessing the sun's energy.
Working on this project has been really rewarding. I would say it's one of the best things I've done in my life, and it's had a major impact on our community, has helped a huge number of women, and is a model for the rest of the country on how to manage waste, at the same time giving jobs to poor women who need a steady income.
As well as delivering medical excellence that attracts patients from all over India, the hospital has always encouraged a uniquely CMC approach to both pure and applied research. This has led to many firsts in areas as diverse as leprosy, cardiology and polio, as well as in surgical, clinical and social fields. CMC's research seeks to develop technology and techniques appropriate to Indian situations that save lives and make good health affordable. 8 years ago, Dr. Cherry Kang and her research team made the commitment to try and develop an affordable vaccine that could address the challenges of rotavirus diarrhea in children under the age of 5. After all, 30,000 children a year in India were dying of the gastro disease. How they created their research program and its outcome is a true reflection of the unique way CMC engages with the people and the communities they are committed to serving.
Well, I wouldn't think it was very responsible of us to do research in a community where we did not offer services. So the purpose of this clinic is to be here and generally to improve medical care for the community. There is a research clinic next door, and if we are doing observational studies or recruiting into a clinical trial, we will send children there.
Using the research from the community clinic, Dr. Cherry Kang's team has proved the effectiveness of a rotavirus vaccine that is now being championed by the Indian government.
It feels absolutely wonderful that we took something that is an Indian problem, had Indian scientists investigate it, and had an Indian company develop a product that will be used for all Indian children.
You know, India has always been plagued by infectious diseases such as malaria, filaria, leprosy, and tuberculosis, but that's rapidly changing now. It's now being replaced by the lifestyle diseases such as hypertension, diabetes, heart disease, psychiatric illnesses, and road traffic accidents, which is now placing a huge burden on our institution.
The challenges for CMC in the immediate future are most apparent in the hospital's busy accident and emergency department, where resources are stretched to the limit on a daily basis. Dr. Thomas Banu looks after trauma victims from road accidents and other mishaps.
This is a high pressure area, as you can see, and a little earlier on this place was quite calm, but as the day picks up, this place is going to be full. These 5 beds will not be enough. We have had situations, sadly, where we have had to close the casualty down because we are totally full. And it's hard. We can't turn them away because that's a very cruel thing to do, but that's the reality.
CMC has always responded to the needs of the society at different points in time. This facility is no longer enough for the large number of patients that we are seeing. So to meet these new challenges, we are planning to build a brand new hospital. This is a 1,000-bedded complex which will house the new lifestyle disease departments like cardiology, neurosciences, cancer sciences, and most importantly, trauma, which will open out a service facility for these large number of trauma care patients who come off the roads. It will be designed in such a way that it will be accessible for all sections of society, the poor, the affording, the not so affording.
Of course, Dr. Chandy is only too aware of the investment needed to ensure CMC continues its mission into the future. For inspiration, he makes regular visits to the site of the new hospital at Kanigapuram. This is a tremendous challenge, requiring assistance from supporters, both large and small.
We believe that everything we do, whether it's healthcare, patient care, service of research, is rooted in values that the Christian faith teaches us.